Good morning, good evening from wherever you're watching. I just remembered that I need to get my AirPods connected. So, let's see if I can get these connected. All right, we are in. So, we will get the other Dr. Stanley in here. Oh, come on. There we go.
I'm Dr. Stanley.
Miguel. Will
I'm
the
Dr.
real
Stanley.
Dr. Stanley please stand up?
I'm Dr. Stanley. Listen.
You know,
Oh,
I
man.
posted that thing, two Stanleys are better than one, and one of my friends texted me, he said, this sounds like a porn video. You guys may want to be careful.
I have to say, and just for the record, that was genius what you did. I mean, my wife loved it. It was the best reaction. You did that yourself. It's
Yeah.
genius. It's really good.
Thanks.
I think the first time, I mean, I've known you for quite some time, but the first time that happened was we were lecturing in Vancouver,
Yep.
and somebody went on stage, and I think you'd spoken, and it got all mixed up to Stanley, and then it was like you were Stanley one, I was Stanley two. It was very,
Right,
very
right,
funny.
right. Yes, yeah, someone came up to you, I think, and was talking to you about something I was doing or vice
Yeah,
versa.
yeah. Okay, so she came up to me and told me how that we had a mutual friend, and I'm like, what? And you were standing next to me, and she was like, yeah, because we have a mutual friend, and this and that. And no, she came. She said, are you Dr. Stanley? I said, yes.
Yes.
We have a mutual friend. Blah 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 blah. And I'm like, this is the one you want.
Yeah.
How you doing, buddy?
I'm good. How are you? I just spent an hour and a half playing in the dirt with my son, so that was
Oh
fun.
man, I just went cycling with my daughter. We have kids the same age, right?
Yeah,
So
yep.
how old's Velko?
Valko is 3.5 almost.
Three and
So
a
he was
half.
3 in January. Yeah.
Yeah, Luna is 3 in June.
Oh, okay. Yeah,
So yeah,
just a
I
little
got
bit
a
younger.
I got one of those cheat bicycles, an electric bicycle,
Oh, yeah.
and I got a little thing, and I put her on the front, and we go cycling. But now with the COVID, uh, we have to stick around the neighborhood.
Yeah.
So, and I'm getting a lot of, Papa, why is everybody wearing a face mask?
Yeah.
And so I've told her about what really happened. And all of a
Hmm.
sudden she starts asking me, like, how does a virus react? And I'm like, hey, you're too young for that.
Yeah, yeah, yeah. Don't worry
I,
about the important stuff right now.
it's a crazy time we're living in, man.
Yeah. So for any of my followers that may not know you, maybe they've been living under a rock, why don't you explain who you are? Introduce yourself.
All right. Well, I'm Miguel Stanley. I'm half British, half Portuguese. I was born in South Africa. My mother's British, father's Portuguese. They met many years ago in Durban, South Africa, where I was born on the Indian Ocean. I have three siblings. And I lived in South Africa till I was 10, and then my family basically were totally against the apartheid regime. We left before Mandela got freed, so we left in 1982. I was 9 years old, and moved to Portugal, where I've been living for the past 35 years, with a little bit of time in London, bit of time in Paris, 2 years in
In
LA,
LA? Yeah.
and I am married to a Ukrainian French former model, and I have two beautiful daughters. My youngest is 2 months old, and Stella and Luna is almost 3, as I said. And I've been a practicing dentist for 22 years. Fell into dentistry. I wanted to be a heart surgeon. Dentistry seemed like pretty cool, because while I was studying my first year of what you would call pre-med,
Yeah.
I was a delivery boy for a local dental lab to make some extra bucks.
Oh,
I
yeah. I
had
remember
not
hearing the
many,
story.
yeah, and so I had a motorbike, and I'd go and delivery. I had a circuit with about 10 doctors, 10
Yeah.
dentists, and I'd go into their practices and see what they were doing, and I was like, damn, these guys have a pretty cool job. And that was 1990s dentistry, 1992, 1993. There wasn't any benchmarking, any of that. And I graduated in 1998 dentistry, and I was very lucky to very early have a Brannemark training in implant dentistry. So I'm classically trained. Mariano Sanz, one of the the top perio guys from Spain, and Bertil Freeberg from Gothenburg. So the pioneers of implant dentistry from the Brannemark Institute. And then later on, very rapidly, I did training in cosmetic dentistry. So from the very beginning, like at the turn of the century, my foundations were very solidly set in designing smiles, cosmetic dentistry, and implant dentistry, guided bone regeneration. So let's say the pioneers in my education were the fathers, so all of the founding fathers of what we take for granted today in terms of science. And I would say that one of the most instrumental people or instrumental groups in my foundations as a dentist was the Team Atlanta. I saw a lecture of Ronald Goldstein in '97. He came to Portugal, and it just like blew my mind. And English being my first language, I think I got a little bit more out of it than the other people.
Than everyone else.
And I said, teach me. And then I started following Maurice and Maurice Salama, and their always inclusive mentality that later led to Dental XP and all of that.
Yeah.
But, before Facebook, 2003, 2004, I was a groupie, like I'm a musician myself. I love to, so I started following those guys, and I think they were the benchmark foundation of this interdisciplinary approach. So again, before Facebook, before social media, I had the solid foundation in creating a team, understanding what a team would do, synergies, because back then in Portugal, people were doing everything by themselves. You had the concept of the super dentist, which is something you don't have in America, which you have your specialists.
Right.
So in Portugal, one guy pretty much does everything. And, I would say, Paulo Malo and all of that came out of that foundation of the super dentist in Portugal. And then in 2005, I did some TV shows in Portugal because I had a background in modeling, much like yourself, which I cringe sometimes when I see the photograph. But, I did 83 TV commercials before I graduated, and that helped me pay my university. So I was learning production, directing, storytelling, and I never thought I'd use that again until I heard about this extreme makeover show in America. Flew out to Las Vegas. I met some people. I was very impressed. Sold the show to a national network in Portugal. And I produced 7 makeover TV shows in Portugal where I diluted it amongst plastic surgeons and all of that. But I showed for the very first time to the public what advanced dentistry could do. So a full arch smile makeover. And we were doing that in 2005, 6, 7, 8, 9, 10, 11, and 12. And through that, Facebook kicked in and all of that. And I realized that to offset this TV fame persona, I had to focus on my scientific journey as well. And I started lecturing as far back as 2002. And learning from these great mentors that we share and that we have, documenting my work. And I've lectured in over 250 countries, 250 lectures in over 55 countries. And that led me, I did some shows on the doctors in Hollywood, and I did recently a documentary for National Geographic.
Which is really awesome.
Thanks, man. And that's my, I like to communicate complex ideas. I like to make that simple. And my lectures in the recent years, I try and speak to let's say the maximum common denominator. I try not to make my lectures too technical because I fear that, you only speak to a small fraction of the community and you can ostracize people that don't have the knowledge. And to cut a long story short, I created the White Clinic in Lisbon, Portugal. White because of white teeth, not because of any racial issues. I've been asked. And I have 40 people on my team, and we have a lot of awesome digital technology.
Oh my gosh. Wow.
But that's only 7 operatories, so a lot more brain power than muscle. We have every single digital gadget you can think of.
You do, and you have multiples of each one too.
Yeah, you know, it's dentistry is my hobby. I don't do golf.
Okay.
I don't collect things. I don't collect cars. I drive a 10-year-old beat up Mini that I inherited from my wife. You know, and I had that money thing before the financial crisis 2010. So on the TV shows, I did all of that, bought the cars and all of that, and I realized that if I was going to make the transition from analog to digital and survive in a very aggressive competitive market and stay relevant, I had to focus on this transition, you know, much like yourself that have gone into AI and you're leading that with Pearl. I didn't want to just be content with making a good living. I wanted to help design the future of our profession. So I'm sorry I took so long, but
yeah, no,
that's
and
what I'm about.
I remember when I first saw you, I was like, oh no, there's another Dr. Stanley. Oh no, he's really good looking. Oh, he's got this beautiful clinic. Oh no, he's, you know, got 10 years on me of experience. I was like immediately intimidated, right? And
that was my thought too. I'm like,
and
I
jealous.
don't have to worry about this guy.
And then when I met you, I think we immediately clicked and had so much in common in, you know, our histories and things. And what I loved about learning more about you was that you were like this, what's the word I'm looking for? You were a leader in dentistry, and really you care about our profession and care about making it better and protecting dentists. And I love all of I don't have my words today, but I love all of the things that you're doing for our profession, and not just like clinically technology, this kind of stuff, but like that National Geographic documentary was so cool. And it's taken, I think that's the first thing that's came out that's positive about dentistry since those old makeover shows, you know, at the turn of the century. It was like, it took 20 years, or I guess when was that? A few years ago. So it took, you know, 17 years, 15. Yeah, okay. 15, so it took 15 years to have one other positive media portrayal of dentistry.
You know, and you touched a few very powerful subjects there. One of them is jealousy, and I really think we need to talk about that.
Yeah.
And I had a chat. I know you spoke with Simon Chard. Big shout out to him. And you know, I think there's way too much jealousy in our profession, and I think it's actually been so detrimental to the message that we need to portray to the public. Because if we just, I spoke about this, you were there at the ADA in San Francisco. I'm very, very grateful they invited me to go lecture there. That we've just done such a terrible shit job at explaining how awesome dentistry is. And that takes me back to my very first TV show in Portugal. One of the main driving forces why I wanted to do it was I'd spent all of this money that I'd saved to go and study with Bertzel Freeberg and Mariana Sanz and learn all of this guided, you know, Danny Boozer, all of those guys, guided bone regeneration membranes. I've been using membranes and GBR for 19 years, Kyle. All right. So this is not a new concept for me. Having said that, now to sit down with a patient that thinks that a dentist is all about extractions and mercury fillings and dentures, I was like, no, the disconnect's too big.
Yeah.
So I wanted to tell that story. And I think that if you've seen what dentistry's evolved in the last decade, just in terms of technology, everybody knows the transition from the gas car to the electric car, and, you know, Elon Musk driving that, and now all of the other companies jumping onto it. Nobody in America knows about the iOS scanner and about CBCT and facial scanning and 3D printing and smile design and AI. And I think that if they did, I think we'd all have a much better job. So one of the things that I know when I did my shows is that if you're talking about dentistry in a positive light, the whole industry grows. Yeah. But what's happening now is that the industry is suffering from this massive internal competition, and dentists are so fearful of promoting each other and this politics and stuff that I think we're doing a disservice to our beautiful profession. So that's the first one. Yeah. And the second one in telling stories, I just think that, you know, we all have a duty to I get a lot of I get a lot of hate, man. You get it as well. If you've got a stage, and I'm really grateful to have had some really amazing mentors, and also to have suffered a lot in my life. I've had a lot of hardship in my life.
Yeah.
And when you go through things like that, I mean, if we've got a microphone, we've got to use it for greater good and not just for our own benefit.
Right. Well, I think that's what's really great about the speaking community now. Well, maybe I should say the high level speaking community, right? The respected speakers in the world is that most people, and most of like our friends, really help each other, give all the credit to the people where it's due.
And the
And
number one guy with that is Christian Coachman. I
for
mean,
sure.
he connected us.
Yeah.
He's probably the biggest connector in the
In
world of
dentistry.
dentistry.
Yeah.
I mean, but without a doubt. And look, the guy is really good looking. He's married
Yeah.
to a beautiful woman. He's
Yeah.
successful. He's an entrepreneur. I mean, if that guy doesn't piss more people off than you and me combined,
Yeah.
I mean, and yet he's also used that to really bring some of the greatest minds of dentistry together. And I just think that's an amazing thing.
Yeah, and I think early in my career, I was that kind of jealous, competitive type of person, and it took me, I think, to go through hard times, but also to learn from my mistakes, how nice it is to not worry about competition and to, be excited when you meet your competition neighbor, like I'm friends with a lot of there's 50 dentists in my building, over 50, I think. I think there's 52. And, becoming friends with a lot of them is great. I mean, there's enough patients to go around, especially in big cities like ours.
It's so, and I spent a lot of time in Beverly Hills.
Yep.
I didn't really understand that, just so my audience can understand, in California, and much like in the UK as well, the building gets the license to practice dentistry, right? It's the real estate gets the license. So because in Portugal and in most European countries, you can open a practice wherever you want, and then you license it as a clinic. Whereas in Beverly Hills, that you have that Roxbury building that literally has about 100
Right.
100 clinics in it. So that's one of the things. And I think that when we communicate dentistry, we need to actually say where we're from, and because despite it should be ubiquitous because it's biology and physics and mechanics and human, but the way that it's practiced around the world because of just politics and finance and the economy is completely different.
Yeah.
And I always thought, I remember when the first time I went to Beverly Hills, and I was at this party in this very big house, and I'm not going to say any names, and it was like a pretty impressive party. And this dentist came up and he gave me this card, and it was like Beverly Hills dentist. And I was like, wow, man, this, like what's that scene from American Psycho, when they're exchanging the cards, and I was like sweating.
Is this eggshell? Is this, yeah.
So I went to go visit this guy's practice, and I was like, hello, the 90s want their technology back, because it was just like, it was kind of shocking. But the guy was driving a super fancy car, and I was like, okay, the public really need to know where their money's going, right?
Yeah.
Because it's. So what do you think about that? How do you think that? And just because you're working on artificial intelligence, and we had some chance to talk about this, how do you think that that's going to change in the future for the public? What do you think the consumer journey is going to be like moving forward?
Well, I hope that we get more positive media outlets about dentistry, similar to what you did with National Geographic. I think that there needs to be more, and I hope that it comes from societies or associations like the ADA, the American Dental Association. I hope that it comes kind of from the top down, and I hope that it doesn't have to be personal. Like I don't have to put out a positive media association. I think it should come in general. I think the good thing about AI is because it's such a hot topic, people are realizing that it's infiltrating every sector of the world, and then they may start asking for it. They may start saying like, well, I have it in my phone, and I have it in my Alexa, and I have it in my car, and I have it in this. Like, do you guys do anything that does AI? And one of the great AI is that it brings transparency to dentistry.
Yeah. That's what I lectured in Chicago. The last big lecture was there at the midwinter, and I was very, very grateful for the American Prosthodontic Society. And I spoke about you on stage because I always give a shout out to people that are doing great things for dentistry. I think
Thank you.
it's just so important to know, but it's important to always share ideas. And so many people are so insecure about their journey that they can't shout out other people. It's crazy. But anyway, my final message was, I said, guys, if there's one message you guys need to understand, is that any dentistry you are doing today, in 5 to 6 years, I believe a patient will be able to go to an independent, and I'm even going to say probably less time, will be able to go to an independent scanning center, get scanned, and AI will tell you if that treatment was badly done, if the implant is actually what the guy said it was, if it's in a good position, if the bone around the implant is good, if the filling is well fit, if the crown is perfectly adapted, the occlusion is good, and basically what's under the hood, because you can disguise with cosmetics bad dentistry, that,
right?
And the body's very forgiving, and the difference between good dentists and shit dentistry is about 6 years. Bad shit dentistry probably start giving problems 6 years down the line, where great dentistry will last a lot longer. But the consumer doesn't know the difference, and I think that, and I can't wait for AI to come in and put this, so the ethics into the industry. So the final sentence was, AI will know what you've done wrong.
It's true.
And you're doing that already, right?
Yeah, because right now, like we do think we're finding bad dentists that are committing fraud and getting them out of our profession. We are, getting an unbiased read of radiographs, an unbiased read of intraoral scans, so that for good or bad, you'll know if you're doing a good job or not. And if you're not, then you can know how to get better. And I know a lot of people are uncomfortable with that.
But honestly, why should you? I mean, it's a big discussion here. But the reason why you have lawyers and judges and policemen and detectives and jails is because there's a part of society that bends the rules, right?
Yeah.
Because if everybody was ethical, we wouldn't need jails and policemen and detectives, right? Now, the rules of dentistry, the guidelines have been set, most of them, the basic stuff, have been set in stone for 100 years.
Yeah.
And every single year, new stuff hits the market, and dentists should actually be updating their software regularly. A lot don't, because the price of post-grad education is complicated. And quite frankly, the consumer isn't asking for anything new.
That's true.
The consumer thinks,
supply and demand.
Hey, my dentist is super nice. He's close to home. He's very fast, and he's cheap.
Yeah.
and you're like, none of that's really anything we studied for, man. So, and it's almost like I can't imagine any other profession on earth where the disparity between what is offered and what people are asking for is so big.
It's true.
It's insane. It's insane. And on top of it, what a dentist is allowed to perform, a general dentist. Now, let's do a graphic in our head. You've got a super specialist, implant specialist, top of the line, like yourself, master, whatever, with 10 years or 20 years of experience, that has a CBCT and uses surgical guides. You're a big fan of that, like myself, and treatment planning and hours and understands, and probably places less implants than he could because he knows what could go wrong, and he's very, very ethical. And then you've got a first-year student who's legally licensed to place implants that has no morals whatsoever and has a directive from his boss to say, make money.
Right.
And the face value to the consumer is exactly the same.
You get an implant.
Moreover, an insurance company doesn't see the difference. The difference between both of them. And the consumer will be impressed by the location of the clinic, the guy's suits, his expensive watch, and his blah, 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 and the price, and factors that have nothing to do. So please, my friend, hurry up and bring Pearl to put some organization into this, because I think that we've done a disservice to humanity by selling dentistry completely wrong. The way we've educated the masses about what dentistry is wrong. Insurance companies have they've got their grasp on this. Governments like the NHS in London, it's a huge mess. It's a mess, and I don't think that you can get dentists to regulate dentists. We've been trying it, and we started the conversation. Jealousy and competition won't let that happen on a local level.
Yeah.
So, I come
and it has to be unbiased, which is the hard part, which is why you need technology.
So I've always said, I come from a country where there's 10 million people and 11,000 dentists.
Yeah.
That's a high ratio of dentists per capita. Mm-hmm. I've been to Uganda, like you saw in my documentary, and there's one dentist, there's 350 dentists for 42 million people. Big disparity. Wow. Now, where I'm getting to here is that
next time you go, let me know. I want to go.
Oh man, you're going to come. Actually, it might happen sooner than later. Well, now depending on the COVID thing. But, and if I do another documentary, trust me, you're the first guy I'm calling. But what I wanted to say here was that organizing dentistry, there's so many organizations out there. There's so many associations and governing bodies. And at the end of the day, much like when you give a course to 50 people, after 30 minutes, you are speaking to the lowest common denominator in the room.
Right.
And organizations, the bigger they are, the more basic they have to be to not leave anybody out.
Yeah.
Which means that I don't think that any organization in the world should control, at the end of the day, the way dentists is practiced, because you can't do it. And this is pre-COVID. Now, I think that control has to come from the consumer. The same way as a consumer, I can say, listen, I'm going to go to, like in Beverly Hills, I'm going to go to the Montage or whatever, I'm going to go large, or I'm going to go to the penthouse suites in Beverly Hills, or I can literally a mile away find a motel for $60 a night, right? Mm-hmm. Both have a door that you can shut, a bed, a toilet, a sink, a curtain, a pillow, but the disparity between one and the other is huge. Now, we don't need the hotel industry to sell that to us, because it's ingrained in the fabric of society. Where is that in dentistry?
Yeah, well, this is something that at my practice we've been trying to do for the last 10 years, is find who our people are and be very honest with people and know that not every patient is right for our practice. So like in our practice, we're high end, low volume, we practice slow dentistry, we'll get into that. We have 2 restorative chairs, 1 hygiene chair. It's like 1,000 square feet, 100 square meters, like very, very small. And we try to screen our patients because we don't want to trick anybody to come in. We know that our fees are fair for the quality that we give, but they're high on average. So we may tell people over the phone, and all practice management companies say not to do this. We may tell them, we're probably double the price of your last dentist, and we want to be very open with you, and we will probably take twice as long too. And so, and some people are like, okay, sounds good, let's make the appointment. And some people are like, that's exactly what I don't want. Thanks so much, bye.
But I think that one of the upsides of the COVID crisis is that, same way like you, I would never give a quote on a phone, because I need a CBCT to give a quote. I've been using CBCT in my practice for 11 years, sorry. But we can give a general ballpark figure. And where am I getting at? Is that we've now started screening, not that we're treating, but we're having emergency people calling in. But I think that we're going to be a lot more open, much like you saying, if you can't pay for the services that we're providing and the levels of safety and understanding and the depth of wisdom, don't come in. Now, again, I know that there's a lot of hardworking practices, and that their clinics aren't in places making, you know, restorative work without the necessary high-end complex technology and materials, and hence can.
Sorry, something happened to my internet. Let's bring back Miguel. Oh, sorry about that.
Is this the Groundhog Day? I'm Dr. Stanley.
Yeah.
So as I
Okay,
was
so where
saying,
were you?
as I was saying, was that there's absolute. I said I would rather have an implant placed in my own mouth with a recent graduate using a surgical guide in my own mouth than a guy with 30 years of experience, regardless of the brand of the implant. That's, I think, secondary, than a guy without one nowadays, with knowing what I know. So I think that it's inevitable that a digital marketplace will have to be created where the consumer, guided by CBCT and an iOS, which is the foundation, it's access into digital dentistry, where the consumer will have an array of choices online, Airbnb dentist kind of thing, where you match the provider and his pricing to the consumer and their possibilities. If you know what I'm saying. And I think AI will have a huge role in that. And I'm just putting this out there because God knows I don't have the capacity to build something like that. But if you do it, I'd like a little cut, bro.
Yeah, we're actually working on something very similar to that. So
yeah, well,
it's coming.
You're very ahead of the game, and I will be your biggest supporter. I know AI scares the shit out of a lot of people, but I think more than any other industry, ours truly needs that measure of ethics and understanding and critical thinking, because we're doing a terrible job at managing ourselves.
Yeah. So let's I guess continue on that, and let's go into slow dentistry. So when I met you, and learned about what slow dentistry was, I was happy because I was like, oh, cool, I've been doing this, and then became an ambassador and started showing people about it. So why don't you give me, how you came about this and what it is and the pillars, and then we'll go a little deeper into it.
All right. Well, I run a private practice in Lisbon, Portugal, and despite being an international speaker, being on television, really being incredibly ethical and having all of this awesome technology, I was seeing that competitive clinics, or let's say competitor clinics, that were marketing themselves as the same thing, were, making what appeared to be a lot more money than us. And I don't suffer from jealousy or any of that, but I was just really curious, like, how is this possible? Because I was like, well, we've got the technology, we've got the doctors, we've got the skills, we've got the capacity. What am I doing? What am I missing? And then it hit me that they were seeing the twice amount of patients a day than I was.
Right.
Because it never went through my head that you shouldn't go slow in between patients, So from day one, I opened my first private practice on the 4th of January 2000. And since then, the minimum number of patients per chair has been 1 patient per hour. What am I trying to say? Is that we don't book 30-minute appointments, even for orthodontists, changing wires, what have you. Several reasons in between appointments. Washing your hands, disinfecting, letting the spray take its full effect. And you're not disinfecting a small area. You have to disinfect the floor, the chair, the headrest, the lamps, the working table, the tubes, change turbine, counter angle, ultrasound, change the ultrasonic tip, clean the spittoon, change the cup, and then, clean the computer keyboard, all of that, wipe it down, write in your clinical notes, open the patient's file. And if you actually go through that in your mind, even if you're not doing that, you've got an assistant doing that, because we have assistants that do that, you can't do that in 2 minutes. You can't do that in 3 minutes. I actually challenge people to do it properly in 5 minutes. Maybe you can, if you have 5 people, like a Formula One thing. So, and then having traveled around the world so much lecturing, what I saw, people were just tidying the consumer to going, we travel a lot. Are you here, Kyle? Kyle?
No.
Can you hear me?
Right.
Hello, bro. Can you hear me? Can you hear me? I can't hear you.
So many lives. They weren't prepared for all of these lives.
Hey, bro.
I my
think you should
last
share.
3 lives.
Don't share the images anymore.
Okay.
Don't worry about that.
Let's see. It's overloading everybody.
So basically, what I was saying was that I started seeing that proper rules of engagement between the doctor and their patient weren't being taken care of. So coming from a place where I was in the public spotlight, I'm quite a successful celebrity, blah, blah, blah. And I'm used to getting a lot of criticism from the haters and the jealous people, because, you've got a target on the back of your head when you're at the front, and that's just part of the game, and you know it. I thought, if I distilled and distilled and distilled everything that nobody could criticize, what are the things that need to be in play that would make a trip to the dentist safer? Not for the dentist, for the patient, because we've already understood a lot of dentists just think about one thing: money. They want to get home as fast as possible and make as much money as possible. And I'm not going to criticize that, because capitalism is, it makes the world go round. I'm not going to say it doesn't. And I think that every dentist should make a lot of money from their profession, but the money should be a consequence of, and not the prime mandate or the prime objective. So, and you shouldn't make money at the risk of your patient's ignorance. Right. And that's what, the first part of our discussion was that there's a lot of ignorance. And anyway, so what I wanted to get to was, what could the public identify as being things that were in play or not in play that would improve their experience, their safety, and that the dentist couldn't disprove or argue? So very early on, I understood it couldn't be technique, materials, technology, protocols, because let's face it, a great analog dentist can do just as good or even better dentistry than a digital dentist. Yeah. You've got very skilled guys that can do things with, so you know what I'm saying? I didn't want to touch that. I didn't want to touch anything that was scientific, and I wanted to really dumb it down. And think about, what would it look like? What would the label look like? And now I love cooking. So I'm a fan of, the slow cooking and all of that. And it just hit me that slow dentistry would be a good title. And I got a lot of pushback, because people say, nobody wants a trip to the dentist to be slow. And then I was like, well, actually, you do want it to be slow, not in the chair, but before sitting down, So in a nutshell, we registered the trademark in 2000. late 2015 or 2016. It's a .com, slowdentistry.com. And what it is, it's a certification. It's a Swiss company. Nina Blattler, who's my sister, she runs the company with her husband out of Switzerland. I really don't have time to manage this. So I'm a PR. I choose ambassadors much like yourself, people that are very passionate advocates for quality dentistry. I think we've got now 22 global ambassadors and counting.
Yeah.
And the 4 cornerstones are very, very simple. Signed valid consent before you initiate treatment. Let me break that down. It's not a blank statement that you sign in the beginning of a relationship with your dentist. It's sitting down and saying, listen, you've got a deep filling here. I'm going to try and save your tooth. I'm going to try and avoid a root canal. But maybe 2 months down the line, or 2 weeks or 6 months, that tooth might need a root canal. I'm going to try and save your tooth. And then when that happens, the patient is not surprised by having pain on that tooth or having to support the costs of a root canal, because you've explained it to them. That explanation takes time. I'm a good communicator. You're a good communicator. It takes time to explain this, now let alone somebody who's not a good communicator. And it should be the doctor and not a receptionist or the nurse, because we're responsible for that. So a signed valid consent. Second, never initiate the treatment until the anesthetic has taken its full effect. Now, you would say, Miguel, duh, obviously, but if I were to tell you that the turnaround time for clinics on the NHS in the UK is 15 minutes, how are you going to manage a patient with an inflamed lower right molar, where you know that that anesthetic sometimes going to take 20 minutes, 25 minutes to take its full effect before you can? And the reason is every patient has a right to a pain-free experience when anesthetic is required, obviously. But again, we're a global network, so we're focusing on all countries. This has to be ubiquitous. So anesthetic full effect. Third one, very simple, rubber dam on all root canal treatments and most direct restorations. Now, I would like to say all direct restorations, but it can be argued that some direct restorations don't need a rubber dam. And when I say direct or indirect, I mean, look, we know Nazari, yourself, myself, I mean, we put rubber dams to cement our crowns, but I don't think that is mandatory. But I think to do most restorative work, you should put on a rubber dam, but no contest, all root canal. And I've interviewed a lot of root canal specialists around the world, and quite frankly, that ain't happening. Why? Time. Anybody can put on a rubber dam. They don't do it because the patient doesn't ask for it, and it takes a little too long. So rubber dam. And the final one, and the one that everybody's talking about now, is proper disinfection in between appointments. So we've spoken to a lot of brilliant people in the field, scientists, and we've come up to between 8 to 10 minute turnaround time in between appointments. And that's literally between the patient gets up out of the room and the new one sits down on the chair, is roughly 8 to 10 minutes. Not 2, not 3. No matter how fast your filters and sprays can disinfect, that turnaround time, the chair shouldn't be hot. And this, you have no idea how much pushback we got. That's not profitable. We can't do it. We need to see more patients. And quite frankly, before COVID, I was getting laughed at a little bit. People are like, come on, man, that's never going to work. And now, thank you for being an early adopter, an early believer. And I know you've been doing it all your have around the world, but we didn't have it. And the name for that is Slow Dentistry.
Yeah, well, I think the problem that most people have is, and speaking American community, is most American practices incorporate insurance. And with insurance, you have a fixed fee schedule. In my practice, we don't, because we don't think we can do the proper treatment on that fee schedule and take the amount of time. And I think what I try to speak to a lot of my colleagues about this is insurance is a marketing firm. The reason why you sign up for insurance is to get patients in the chair. So take that money that you would spend on insurance, or that you're losing. Take what you think you should charge, and then take what insurance is paying you. Take the difference and use that as marketing. So if you're a private practice that doesn't take insurance, you need to market to get patients. And that's the hard part that many people push back on this, is because how can I make any money if I'm getting paid $100 for a filling and I have to take, an hour and a half to do it?
I'm gonna answer that in two different ways, and I might offend a few people here, but you know me, I'm not here to please people. I'm here to talk truth.
Yeah.
And who the hell studied insurance companies in high school or university or dental school or postgraduate? I've never studied that. I never saw Mary has 16 cavities, missing 2 teeth, an overjet. Oh, and she's got this insurance. We're not trained to do that, and yet we're doing it. We have no skills to filter that. And I was quoted saying in 2008, finance-based diagnosis is killing dentistry. The second you put money in the equation before you do your diagnostics, you are being unethical. And I don't care who that offends in America or around the world or in Portugal or anywhere. The fact that you are bending the science and the rules and the ethics, nobody puts a gun to your head and say, you have to make that decision. You have 2 choices: fight it, quit, or change profession, or go somewhere else and work where you can stand up for gold standard dentistry. Because you're not, I see people in the most remote parts of the world, some of the best dentistry coming from places you wouldn't even begin to imagine. And yet here we have people that are like, oh, but it's comfortable. We didn't study dentistry to be comfortable. It's one of the shittiest jobs in the world, man. It's a tough, crazy job. And the second we let financial institutions dictate science, it's insane. And I'm really against it. And I know people got to make a living, but cracking up there a bit. Hello? Having a little technical issues there. I'm still on. All right, so Kyle is having technical issues there, but this is his webinar. Kyle is flashing on and off. Yeah.